You know Dr. David Naylor well by this time. He is the former Dean of Medicine, now a Professor of Medicine at University of Toronto, but also the co-chair of the National COVID-19 Immunity Task Force. He's in Toronto this morning. Hello, Dr. Naylor.
Good morning, Heather.
Nice to have you back. And on behalf of a couple of other professors, colleagues of yours at U of T in the medical school, caught our eye, of course, as it always does when you write an op-ed piece in the Globe. And I have questions about that, if I could, today. One of the things your piece does is makes crystal clear the lay of the land. Talks about the third wave of the COVID-19 pandemic may be the greatest healthcare crisis our country has faced, calls this the apex of the pandemic. Where are we right now?
So we are heading to the crest of a third wave that is, quite unsettling in terms of its potential impact on healthcare. Heather, a couple of provinces, Ontario and Alberta, have very high caseloads per capita, which means that you're looking at a situation where there's a real pressure on the healthcare workers, on the facilities, potential to really get into trouble in terms of having to do a lot of ICU transfers. That's already happening in Ontario. We have capacity in the system, but there is geographic concentration of cases. And we also have a lot of healthcare workers on the front lines who've just been going nonstop for a year. So very tough few weeks ahead, which means it's just critical, not only for governments to make good decisions, but for Canadians to, I hope, one last time to hunker down, to heed these public health measures, and to try to keep each other safe and avoid further infections and rising caseloads. Of course, we see only, Heather, what we see now happened 2 weeks ago, so we still have some ways to go, I think, before we're at the full peak, but we're in trouble and we just need to hold on here.
You mentioned government decisions, and I do want to come back to that, but it seems to me the purpose of this piece is really to speak directly to Canadians, to deliver a call to action. You salute the heroic response on Canadians' behalf so far. But, I mean, you said hunker down. What specifically is the most important thing that each individual Canadian should be thinking about and doing right now?
Yeah, so the important things are the same old things as before. Be very careful about contact with people outside your circle, your trusted circle. Be smart about using masks. The science is pretty clear now, and that is double masking is prudent. You wear a medical or procedure mask under a cloth mask. That is the most efficient thing. By all means, get outdoors, but remember that this virus has some airborne characteristics. It can spread even outdoors, so keep your distance and be smart about that too. And just hang in there in terms of being careful. All those measures that people have been doing matter now more than ever. Everyone's sick of them. Let's be clear. We have a pandemic of fatigue with the pandemic, but yes, people just need to be smart.
So you're right about what's at risk if they don't adhere to these rules and guidelines. And the piece refers to, and again, I'll quote it back, some painfully bad decisions by governments. And then later on, you write, banning children from playgrounds or bolstering police powers undermines public confidence and morale. Would you put those measures into the category of painfully bad decisions by governments?
Yes, I would, unequivocally. I think, unfortunately, on Friday, although some wise steps were taken by the Premier of Ontario, the ban on playground gatherings, I get it. We have parents and kids together in playgrounds, but there has to be some proportionality. Reminder to mask up and be smart about distancing among the adults would be what was needed. I called that the P2 strategy. You've heard of the P1 Brazilian variant. We had policing in playgrounds as our Ontario strategy. It made no sense. And similarly, policing, I was gratified the police chiefs in general refused to go along with those ideas. We can't have police stopping people randomly to add to the frustration. And we also know that racialized neighborhoods and areas where there's high density housing, where people need to get out to stay mentally healthy, to try to stay well, those are the places where there's likely to be more stopping randomly. So I thought this was a very misguided set of actions. Glad the Premier walked back the playground edict. I wish he'd walk back some of the outdoor bans that are also part of that set of regulations. And very glad that the police chiefs and police boards across Ontario said that this was, an unhelpful request to them to do something that really was not going to help.
The outdoor bans, golf, tennis, basketball courts, outdoor recreational activities, many people have raised questions about that. Are you concerned about the science that Ontario is following in its decision-making?
No, I think Ontario has a spectacular science table. It's just unbelievable. The
But I spoke to Dr. Uni yesterday, and he said this was not his recommendation. He's been very forthcoming in saying whatever he's recommending, Ontario is not heeding.
Yeah, so you asked me about the science. I know what
the science is solid. It's whether or not Ontario... Okay, let me rephrase that. Are you concerned that Ontario is not acting on the science that it's being provided with?
Absolutely concerned. I think that there's been warnings given by the science table and by many others over the last number of months, actually. This goes back to the second wave when we were slow to act again. And here's the reality, Heather. We can probably get out of this in the next few weeks if Canadians, come up to all these measures one last time, and if we can keep the vaccine pace up. But it's going to be a lot harder than it needed to be because not just in Ontario, but in several provinces, warnings were given that said, we have to be careful now with the variants in play. This is a more infectious strain of the virus that's out there, 2 or 3 of them that are a threat. And those warnings were given to say, slow down. The UK is our example here. The UK heeded those warnings. They locked down on about December 20th. They kept that in place for several weeks while they ramped up a very aggressive first doses fast vaccine campaign, 60% AstraZeneca, 40% Pfizer. And, I got an email this morning from the Vice Chancellor of Cambridge, an old friend, who said on Sunday he had a pub dinner. It was outside, it was distanced, but things are opening up. That's where we can be in a few weeks. But we have to have good decisions by government. They have to listen to the science advice they get. And we have to keep vaccinating even faster than we are now.
Expansion in the AstraZeneca eligibility in a number of provinces today, perhaps moving in that direction. But the things that you've been advocating for, you and others, and again, I was struck by you said the province did take some wise steps on Friday. But one thing that the province did, and this is Ontario, and actually it's everybody except Quebec and PEI, ensuring coverage of high-risk populations and instituting paid sick leave. Those measures were not there in Ontario, are not there widely. And I was speaking to Dr. Isaac Bogosh about this earlier. I was wondering if anyone has explained to you in any sort of compelling argument why no jurisdiction is going to that measure, and if you think anyone ever will.
I have no idea. I wonder if it's ideological. I think BC actually is heading in that direction now, which would be another one, thank heavens. There's some sense that the federal government has provided pandemic pay, but what we've seen is that it's not doing the trick. So maybe the federal government and the provinces need to talk to each other and work out some joint deal to take the financial pain out of this. It doesn't have to be permanent. Many believe it should be, but if you've got some great principled or ideological objection to it in your government, then do it as a temporary measure. Call it, interim pandemic relief pay, whatever you want to call it, but get it done so essential workers do not have to go to work sick to put bread on the table. This is just common sense to me and common decency. Dr.
Naylor, thank you very much. We always appreciate our time with you and your expertise and perspective. We'll see you again soon, I hope. Dr. David Naylor in Toronto this morning.